everyone. Again, I hope everyone is doing good. My name is Dr. Lola with NSD Mental Health Services, and today I would like to talk about marijuana or cannabis and its effect on mental health and everyday lifestyle. Okay. All right. So marijuana is the dry leaves and flowers of the cannabis sativa or cannabis indica plant. The stronger forms of the drug include hypotensive strains known as sensimilla. Of the more than 500 chemicals in marijuana, delta 9 tetrahydrocannabinoid, known as THC, is responsible for many of the drug's psychotropic, mind altering effect. It's this chemical that distorts how the mind perceives the world. In other words, it's what makes a person feel high. The amount of the THC in marijuana has increased over the past few decades. In the early 1990s, the average THC content in marijuana was less than 4%. It is now about 15% and is much higher in some products such as the CBD oils and other extracts. Scientists do not know what this increase in potency means for a person's health. Some people adjust how they consume marijuana by smoking or eating less to compensate for the greater potency. There have been reports of people seeking help in emergency rooms with symptoms including nervousness, shaking, and psychosis, which is having false beliefs or seeing or hearing things that aren't there after consuming high concentration of THC. Some extracts and resins from the marijuana plant with high levels of THC is on the rise. We stated there are several forms of this extract. Smoking and/or cigarettes called joints or marijuana cigars called blunt. Inhaling smoke using glass pipes or water pipes called bongs. Inhaling vapor using devices that pull the active ingredient. These extracts made from the marijuana plant should not be confused with synthetic marijuana, sometimes called K2, spice, or Aba incense. These synthetic drugs are laboratory-made chemicals that are similar to THC that are sprayed molecules on neurons called receptors. All right. Um, Short-term effects of marijuana include altered senses, altered sense of time, changes in mood, slow reaction time, problems with balance and coordination, increased appetite, trouble thinking and solving problems, memory problems. Okay, so this is affected with marijuana. Hallucination, saying things that aren't really there, delusion, believing something that is not true, psychosis, having false thought. The risk is highest with regular use of high potency marijuana. Mixing marijuana with alcohol can cause increased heart rate and blood pressure. It can also cause further slowing of the ability to think, solve problems, and react. What are the long-term effects of marijuana? Well, I'm glad you asked. Increased heart rate. When someone uses marijuana, the heart rate, which is normally 70 to 80 beats per minute, may increase or even double, especially if the other drugs are taken with the marijuana. This increases the risk of an heart attack. Respiratory, lung, and breathing problems. Smoke from marijuana irritates the lungs and can cause a chronic cough. Effect is similar to those from regular cigarette. While research has not found a strong association between marijuana and lung cancer, many people who smoke marijuana also smoke cigarette, which do cause cancer. Like tobacco smoke, marijuana smoke is an irritant to the throat and lungs and can cause a heavy cough during use. It also contains level of volatile chemicals and tar that are similar to tobacco smoke, raising concerns about the risk for cancer and lung disease. Within a few minutes after inhaling marijuana smoke, a person's heart rate speeds up. The breathing passages relax and become enlarged. Blood vessels in the eyes expand, making the eyes look bloodshot. The heart rate, normally 70 to 80 beats per minute, may now increase 20 to 50 beats. Taking other drugs with marijuana can definitely amplify this effect. So again, the concern is cancer, heart attack, respiratory issues, things like pneumonia has been attributed to the smoking of marijuana. Studies have also shown in rare cases, chronic use of marijuana can lead to what we call cannabinoid hyperemesis syndrome, a condition marked by recurrent bouts of severe nausea, vomiting, and dehydration. This syndrome has been found to occur in persons under 50 years of age with a long history of marijuana use. Cannabinoid hyperemesis syndrome can lead sufferers to make frequent trips to the emergency room, but may be resolved when a person stops using the marijuana. Marijuana smoking is associated with large airway inflammation, increased airway resistance, lung hyperinflation, and those who smoke marijuana regularly report more symptoms of chronic bronchitis than those who do not. The increased risk for mental health problems, again, marijuana use has been linked with depression and anxiety, as well as suicidal thoughts among teenagers. In addition, research suggests that smoking marijuana during the teen years might increase the risk of developing psychosis in people with a genetic risk for developing schizophrenia. Research are still studying relationship between the mental health problems and marijuana use. Again, in clinical practice, marijuana use have been linked to what we call drug-induced psychosis. For females, increased risk of problems for an unborn baby. Marijuana use during pregnancy has been linked to lower birth weight and increased risk of behavioral problems in babies. Can you die if you use marijuana? There are generally no reports of people fatally overdosing on marijuana alone. However, people can feel some very uncomfortable side effects, especially when using marijuana with high THC levels. There are reports of people who use marijuana seeking treatment in the emergency room, reporting unease, shaking, anxiety, paranoia, hallucination, and in rare cases, extreme psychotic reaction. So it's very important to be aware of what you put in your body. What are the other risks associated with marijuana? I'm glad you asked. Reduced school performance. Students who smoke marijuana tend to get lower grades, are more likely to drop out of high school than their peers who do not use. The effect of marijuana on attention, memory, and learning can last for days or weeks. So again, the poor school performance has been linked to marijuana use. Reduced life satisfaction. Research suggests that people who use marijuana regularly for a long time are less satisfied with their lives and have more problems with friends and family compared to people who do not use marijuana. Impaired driving. Marijuana affects a number of skills required for safe driving, which is alertness, concentration, coordination, and reaction time. So it's not safe to drive high or to ride with someone using marijuana. Marijuana makes it hard to judge distances, react to signals and sounds on the road. High school seniors who smoke marijuana are 2 times more likely to receive a traffic ticket. So when you're wondering why you're getting those tickets, if you're smoking marijuana, it might be linked to it. 65% more likely to get into an accident than other teens. In 2017, 10.3% of 12th graders reported driving after using marijuana in the past 2 weeks. And combining marijuana with drinking, even in a small amount of alcohol, greatly increases driving danger, more than either drug alone. So please be cautious. Marijuana does affect, alertness, concentration. Yeah, it affects your response time. Use of other drugs. Most young people who use marijuana do not go on to use other drugs. However, those who use are more likely to use other illegal drugs. It's even clear why some people go on to try other drugs, but researchers have a few theories about that. Do human brain continue to develop into the early 20s? Exposure to addictive substances, including marijuana, may cause changes to the developing brain that make other drugs more appealing. So please be cautious. Someone who uses marijuana is more likely to be in contact with people who use and sell other drugs, increasing the risk of being encouraged or tempted to try them. Severe nausea and vomiting. Studies have shown that in rare cases, regular long-term marijuana use can lead some people to have cycles of severe nausea, vomiting, and dehydration, sometimes requiring visit to the emergency room. Is marijuana addictive? I'm glad you asked. Yes, marijuana can be very addictive, meaning they continue to use it despite negative consequences. Approximately 10% of people who use marijuana may develop what is called a marijuana use disorder. Problems with their health, school, friendship, family, or other conflicts in their life may result. A serious substance use disorder is commonly called an addiction. The person can stop using marijuana. The person can't stop using marijuana even though it gets in the way of daily life. People who begin using marijuana before the age of 18 are 4 to 7 times more likely than adults to develop a marijuana use disorder. What causes one person to become addicted to marijuana while other does not while others does not depends on many factors, including their family history. So genetic. If you know there is a family history of mental illness in the family, psychosis, using marijuana can definitely trigger the underlying symptoms. The age that they start using, if there is other drugs, their family and friend relationship, if they take part in positive activities like school clubs or other sport. More research needs to be done to determine if people who use marijuana for medical reasons are at risk for addiction as those who use it to get high. Again, you want to be very mindful that people who use marijuana for medical reasons might have a different potency than the one that is found on the street. People who use marijuana may feel a mild withdrawal when they stop using the drug, but might not recognize as symptoms as drug withdrawal. These symptoms may include irritability, sleeplessness, lack of appetite, which can lead to weight loss, anxiety, drug cravings. The effect can last for several days to a few weeks after the drug use is stopped. Relapse, returning to the drug after you have quit, is common during this period because people may crave the drug to relieve the symptoms. What about medical marijuana? I'm glad you asked. The marijuana plant itself has not been approved as a medicine by the federal government. However, the plant contains chemicals called cannabinoids that may be used for treating a range of illnesses or symptoms. Here are some examples of cannabinoids that have been approved or have been tested as medicine. THC, the cannabinoid that make you high, has some medicinal properties. Two laboratory-made versions of THC, which is called Nabilon and Dronabinol, have been approved by the federal government to treat nausea, prevent sickness and vomiting from chemotherapy in cancer patients, and it increases appetite in some patients with AIDS. Again, this are not the same potency found on the street, and again is used to treat patients with AIDS to help them increase appetite, or for patients that suffer with cancer to help prevent nausea and vomiting. It's not the same potency as the one found on the street because people use excuses like, oh, marijuana is now medically prescribed. You know, again, different potency from the one on the street. CBD, another chemical in marijuana with potential therapeutic effect, is called cannabidiol or CBD. CBD doesn't have mind-altering effect and is being studied for its possible use as medicine. For example, CBD oil has been approved as a possible treatment for seizures in children with some severe forms of epilepsy. Okay, so THC and CBD, a medication with a combination of THC and CBD, is available in several countries outside the United States as a mouth spray for treating pain or symptoms of multiple sclerosis. So people use this for medical reasons, for medical purposes. It's important to remember that smoking marijuana can have side effects, making it difficult to develop as a medicine. For example, it can harm lung health, Okay, it can cause cancer, pneumonia, bronchitis, impaired judgment. It can affect memory. Again, it affects your alertness, your response time. Side effects like this might outweigh its value as a medical treatment, especially for people who are not very sick. So, underlying word, people who are not very sick. Another problem with smoking or eating marijuana plant material is that the ingredients can vary a lot from plant to plant. So it's difficult to get an exact dose. Until a medicine can be proven safe and effective, it will not be approved by the federal government. But researchers continue to extract and test the chemicals in marijuana to create safe medicine. Okay, for people who might consider or who suffer with marijuana use disorder, um, there are several therapies that can help. Cognitive behavioral therapy is a form of psychotherapy that teaches people strategies to identify and correct problematic behaviors in order to enhance self control, stop the drug use, and address a range of other problems that can co occur with them. Another type of therapy is called contingency management, a therapeutic management approach based on frequent monitoring of the targeted behavior and the provision or removal of tangible positive rewards when the target behavior occurs or does not. So, a kind of reinforcement, right? Motivational enhancement therapy is a systematic form of intervention designed to produce rapid, internally motivated change. The therapy does not attempt to treat the person, but rather mobilize his or her own internal resources for change and engagement in treatment. So there are forms of therapy that can help to address this if the individual is willing to quit. Well, I hope this has helped someone. Please be individually self-aware. If you do smoke marijuana, you want to assess yourself, assess the effect it has on you, and also think about the future. Think about your family, the effect it has on them when making your decision. Currently, the FDA has not approved any medication for the treatment of marijuana use disorder, but the research is still active in this area because people with marijuana suffers with sleep problems. Some medication that might be helpful are things like Ambien, which is a sleep medication, or even an anti-anxiety medication like Buspirone or Buspar, which is good for long-term management of anxiety. Some prescribe anti-epileptic drug like gabapentin to help improve sleep and possibly the executive function as well. Other agents being studied include nutritional supplement and chemicals called FAAH inhibitors, which may reduce withdrawal by inhibiting the breakdown of the body's own cannabinoids. Anyways, that was a mouthful. Thank you so much for listening. Again, my name is Dr. Lola with NSD Mental Health Service. Thanks for joining. Thanks for listening in today on another episode of Mental Health Talk. Please do not forget to subscribe to our channel for more mental health topics that is affecting families today. Thank you and have a good day.